à compter de mardi prochain.
And the weekly updates by borough will start next week on Santé Montréal.
Comme on le fait toujours, on vous demande bien sûr de mettre votre téléphone en position muet. Si on devait avoir un retour de son, on va couper la ligne automatiquement. Sur ce, Dr Drouin, directrice régionale de la santé publique de Montréal.
Dr. Drouin, Montreal's Regional Director of Public Health, the floor is yours. Hello, everybody. I'm pleased to see you. The last press conference was last June, so I hope that everybody has had a nice summer to get some rest, but also to reconnect with our loved ones and friends. I think that after the difficult year that we've had, this was good for all of us. Of course, today we're providing an update of the situation. The situation is evolving and has been for several weeks. So over the past 5 weeks, we see that there's an upward trend in the number of cases, which is linked to the Delta variant and Montreal, including Laval. So the Greater Montreal region is certainly at the heart of this increase in cases. So we are in the fourth wave. Over the past week, it's an average of 170 cases, and we can see once again this week that it's continuing to increase slowly. Around half of our cases are Delta variant cases. For comparison, last year, we had, in terms of incidence, so the number of new cases per day, we had the same numbers, but at the end of September. So we have more cases, more community transmission, whereas the children have not even gone back to school yet, so we don't yet have the effect of back to school. And of course, with a variant that is much more contagious. Luckily, vaccination is there and will probably bring us another picture of the fourth wave in terms of impact, of course, on hospitalizations, intensive care, and deaths. We're observing the group in which we have most cases is the 18 to 34-year-olds since the end of July. However, we see an increase in all of the age groups, including young people, school-age children. Our rate of positivity is also increasing 3.3%, and we've got a few neighborhoods that stand out and that already have a rate of positivity that are beyond the 5%. So Saint-Michel, Parc Extension, Bordeaux, Quartier-Vide, and Rivière-des-Prairies. In terms of management of outbreaks, it's not the same numbers as we had in the spring, where we had hundreds of outbreaks. So currently, we're managing around 46 outbreaks. We can see a progression, mainly in workplaces, but we also have 22 that are linked to public places and events. And I would like to talk about an outbreak that we're seeing. We've got 11 outbreaks that are related to different events with dance, inside and outdoors, and now it involves spectators and dancers. And in that context, of course, as you know, contact tracing, the more we deconfine, the harder it is to trace back contacts. So we want to have a certain vigilance. So if you participate in these types of events as a dancer or as a spectator, of course, wear your mask if you're dancing. So choose your partner wisely. Keep a distance, keep an eye on your symptoms, and if you have any symptoms, go get screened. We avoid hugs and social contacts, and if you're a case or a contact, when public health calls you, we ask you, of course, to pick up the phone and to collaborate with us. With the hospitalizations and intensive care up until now, we have a rate of occupation that is quite low, so we still see the positive effects of vaccination. Last week, we're talking about 16 new hospitalizations and 4 new admissions to ICUs. And provincially, we can see that the rates of incidence, so new admissions, are much more significant with people who are not vaccinated than for those who are vaccinated. But of course, we will see certain breakthrough cases even if we know that the vaccine protects very well overall when it comes to the severe version of the illness. So one important message for you today is that, and that's related to the Delta variant, we know that it's more contagious, so the viral load is greater, it lasts longer, it generates, of course, more severe forms of the illness, and the efficacy of the vaccine is not as great, and the data is accumulating to this effect. So the message is, of course, go get vaccinated because a vaccine overall is effective. It helps us avoid the severe forms of the illness, so it reduces the risk quite a bit. It also reduces the risk of getting the infection if you are in contact with a positive case. However, it doesn't mean the tool is not perfect. The vaccine is not perfect. So we will see some people who are doubly vaccinated who are infected with symptoms or not. And we will also see in lower numbers, so people who will develop more severe types of the illness. So go get vaccinated. And what that tells us is that with greater community transmission, we must get back to the actions that we've been applying for close to a year and a half. So wearing the mask indoors, physical distancing. When we had lower rates, I saw a lot of people hugging and stuff. So we have to avoid these types of social contacts, even when we are vaccinated with both doses. And as soon as you have symptoms, even light symptoms, because of course with vaccination, we have greater chances of having mild symptoms or to be asymptomatic. But if you have any symptoms at all, go get screened. Now back to school. I wanted to say a few words to salute yesterday's announcements. For us, it's very good news to see that the mask will be required throughout schools. Of course, that will help us because right now, for Montreal, of course, elementary school, the children are not vaccinated, and in high school, we have only double vaccinated approximately 53% of young people 12 to 17. So clearly, we know that the virus will circulate. So the wearing of the mask is certainly a tool that will help us to control outbreaks. But we will also visit all the schools to vaccinate. Vaccination is important individually, but also collectively in order to control. And I would tell teachers and educators in daycare, please be conscious of the fact that the virus will circulate within the populations. As adults, you will be at greater risk. So I invite you, if it's not already done, to go get your 2 doses because you are older, of course, and we know with children, the form of the illness are very mild. But the older we are, the greater the chances of having a severe form of the illness. So please take your appointment or just go to a walk-in clinic. The vaccine is very accessible. So, of course, we are preparing with the school settings for the managing of cases and contacts. The CS teams will be, the vaccination teams will be in the schools. We're asking parents to collaborate, to bring the students to get vaccinated so that we can improve our vaccine coverage, and that will also let them have access to all sorts of extracurricular activities which require 2 doses of the vaccine. And of course, since we know that the virus will be traveling, we'll have this protection in the classrooms with the mask that will be worn, but in all the other social contacts that our children may have, of course, the safer the contacts are. If there's a case, well, we will isolate fewer people. So, of course, we're trying to limit all of this. So I wish you a wonderful back-to-school period. We will follow the situation closely. It's evolving quickly. And I think that we still have a few weeks ahead of us to improve our coverage rate and to put in place some good practices that we have applied over the past many months and which have proven effective. There's not a magical solution. It's a combination of all sorts of strategies that will help us. Well, we're not going to avoid the 4th wave, unfortunately, but at least we will try to, we'll have fewer hospitalizations and admissions to ICU. Thank you. I'll now make a few words in English.
So today, after a break since last June, we want to do a small briefing on the Montreal situation. We see, of course, since last week's, we've seen an increase in almost all our indicators, our incidence rate, and of course, it is associated with the introduction of the variant Delta. We have an average of about 170 new cases each day, and more than half of our cases are associated with the Delta variant. If we compare to last year, we had those same indicators at the end of September, so we haven't seen the effect of the opening of the schools, and still we have high incidence rates. So we expect, of course, seeing a larger number of cases in the next couple of weeks. Our incidence rates are highest in the age group 18 to 34 years old, but we also see an increase in the 5 to 17 years old age group, the school-age children. We also see a positivity rate that is increasing, and we have in some neighborhoods more than positivity rates higher than 5%. So we see in Saint-Michel, Parc Extension, Bordeaux-Cartierville, and Rivière-des-Prairies. We are managing currently 46 outbreaks, and I want to do a focus on specific outbreaks that we've seen. We have 11 outbreaks specifically associated with different gatherings around dance or the dance communities. And we see cases in the dancers, but also spectators. So the tracing is quite difficult because, of course, those events are outdoors or indoors, and we do not have any registry. So we ask people that do attend those events to be more precautious, keep their distance, of course, wear masks if they're indoors. If they are dancing, choose their partners and avoid changing partners. And of course, if you have any tests, please go and get screened to make sure to validate if it's COVID or not. Good thing is, as we're speaking, we still have low hospitalization rate and intensive care unit admission. Last week we had 16 new hospitalization and 4 admissions in intensive care. In our projection, it is going to increase, but at the time we're speaking, the capacity of the healthcare system is still there. Of course, knowing that the Delta variant is more contagious, and of course it is more at risk of severe form of the illness that compared to the Alpha variant, and knowing that the vaccination is good, it protects from severe illness, but it is not perfect, even with 2 doses. We really, of course, ask our population to get vaccinated because there is a gain at the individual level, but also collective level. But we ask people to be more precautious in their contacts, keep their distance, wear masks when they're indoor, wash their hands. And of course, I know during summer we had the reflex to sometimes shake hands or do accolade or a kiss. I think with the circulation of the Delta variant at the time we're speaking, we should be precautious and do the same reflex that we had during the last year to wash our hands, wear masks, and keep our distance. The schools are reopening. We're quite happy to see that the mask is going to be mandatory at all time in classes. It's going to help us to, of course, control outbreaks, but also when we will have to do our search and contain strategy. We are going to have all schools are going to be visited for a vaccination campaign, so it is going to be offered to teachers, people working in the school setting, and of course children. And we do still have a lot of progress to do in Montreal. 52% of our 12 to 17 years old youth are fully adequately vaccinated, it is not enough to have at a collective level an impact on the school to contain the outbreaks that we're going to have, or to help us contain the outbreaks. So we ask teachers to get vaccinated, and also people working in daycare centers. If you're working with school-age children that are not vaccinated, you should really consider yourself more at risk of being in contact with the virus this fall. And because you're older than children, the risk of having more severe form of the illness is higher for you. So please attend or get your 2 shots as soon as possible. So we're working with schools to make sure that we have back to school that will be secure for all children, and as possible as we can, make sure that children could attend a school in presence. So we may have to adjust during the next weeks, but at the time we're speaking, we're working with this scenario. Thank you.
Merci, Dr. Drouin. On va débuter la période de questions en français avec les journalistes qui sont présents en salle, suivi par les questions en anglais. Évidemment, on va passer au téléphone par la suite. On débute par Alice Girard-Bossé de la Vraie. C'est une question et une relance. Merci aux journalistes de vous nommer et de dire les médias que vous représentez avant de poser votre question.
Bonjour, Alice Girard-Bossé.
Question.
Bonjour, Madame Drouin.
Hello, Mrs. Drouin.
Vous l'avez mentionné, la
You mentioned it, the vaccine coverage for young people 12 to 17 is quite low. And with back to school around the corner and the beginning of the 4th wave, will we have to add new measures in the schools? Well, clearly, the mask is there, and for us, that's a measure that we were hoping to have, and we're very happy it's going to help us in the management. In our discussions with the schools, what we are looking at as well, because the schools have applied the Cadillac of measures all of last year. They know the measures that they can put in place to reduce the contacts. The notion of class bubbles was not chosen, especially in high school with the course options. It becomes very complex for the schedules. However, in certain schools, and with the school principals, when it's possible to put in place some measures, for example, a cafeteria plan, or in the yards, to put some limits that will allow us to easily trace back contacts if there is a case or an outbreak. All of these measures are welcomed. So currently, each school can adjust their measures. Of course, if we have some schools where we see that there's an outbreak, or, well, maybe we will add some specific measures. But for the time being, we're letting each school implement the measures that are appropriate for them to control in the yard or in extracurricular activities where we may broaden the number of cases or of social contacts. There will be many festivals in the next few weeks and months in Montreal. With the 4th wave that has begun, will the vaccine passport be enough to allow these events to occur? Well, I think that the events will occur. The vaccine passport is clearly a very good measure in that context, knowing that we're on an upward trend. And I think that we got a lot of requests because a vaccine passport is there. Can we ease the measures even more? And I call it throwing oil on the fire. At this stage of the game, we're not going to loosen the restrictions, even if we have a vaccine passport. And we're dealing with vaccinated populations. I'm reiterating the message. Even double vaccinated, we are not invincible. We can get infected. We can be asymptomatic and transmit the illness. Luckily, we have fewer chances of having a severe form of the illness. So it's possible that we'll have some cases and some outbreaks. So basic measures in these events will be in place as much as possible. Question. I want to come back to events and the population. About a year ago, we were talking about outbreaks in dance events, and you're talking about that today. Yeah, it's like a movie on a loop. Yes, you're coming back with talking about the masks and the hugs and all of that. So don't you think that it's going to be discouraging for people who are still hesitating to get vaccinated or who hesitate to respect the measures? Because now we're asking them even more, whereas in theory we had sold them the idea that with a vaccine, everything would be settled. We would have liked for everything to be settled with a vaccine, but of course, the data on immunity linked to the variants, that brings us to reconsider. And I think that clearly we're facing a fourth wave. We've got efforts to deploy, a little bit like I said in March and April. With the third wave, we've maintained some measures in place, and we succeeded in avoiding the third wave. This one, we will not avoid it. It is here. 50% of our cases are Delta variant. There will be an increase in cases. The question is to try to minimize, of course, super spreader events, and to minimize, of course, the cases that will end up in hospitals and intensive care. The vaccine remains one of the essential tools. The super spreader events, well, of course, we have to avoid them by adding a few measures, so reducing the number of contacts. Of course, we had a lot of contacts this summer, but the virus was not very prevalent. The variant was not very prevalent, so the risk. But now, with the schools, with back to school, and the current circulation of the virus is increasing day by day, so clearly, before the peak of the fourth wave, we must put a few measures in place, and we know them, and they're not that severe, but they could have an impact to reduce mortality and morbidity. Now for the schools. What do we expect? It's not the right timing to have back to school, right, with the fourth wave. We know that young people are not all vaccinated, far from it. Do you really expect a number of outbreaks that will increase exponentially? How do you see the situation? No, I don't have a crystal ball. If you want my feeling, is that there's going to be important circulation of the virus because the Delta variant is so contagious. We know it's transmitted easily, and we have more contacts. Luckily, with young people, the severe forms of the illness are much less prevalent. When we look at what's happening in other countries that are a little bit ahead of us with the wave and the Delta variant, we can see the fact that it's more contagious. We'll have a lot of people who are infected, and there will be a proportion of them who will have a more severe form of the illness that may require hospitalization, and we saw this in the U.S. There was some pediatric hospitalization, so we'll see some of that. If we try to project ourselves in the future, vaccination of the 5 to 11-year-olds comes towards the end of October, beginning of November. That would be a wonderful gift that would help us to take one step forward. But with this wave that's coming, we will have a lot of people who are unvaccinated, perhaps some who are vaccinated, who will get the virus. So clearly, there will be a natural immunity that will be added to the immunity that we get through the vaccine. So I think that we will still progress in the right direction. But at the same time, I don't want all children to get the COVID. I prefer to wait until the vaccine is approved before too many kids have the infection.
Bonjour, Madame Drouin. Pascal Gachette.
Question? Last year in August, we had approximately 100 new cases, 124 hospitalizations, 6 deaths, and 12 months later, the situation is a bit more complicated. The data say 550 cases, 1 death, and about 100 hospitalizations. How come we are stagnating, whereas we've got vaccination? Well, I think that currently, it's not the same virus. We didn't have the same virus last year, so clearly it was a virus. It wasn't even the UK variant. It was the initial virus, which was not as contagious. So clearly, this is what is changing the equation. Vaccination is one of the instruments, well, the main instrument that will help us to reduce mortality and morbidity and hospitalizations, ICU, and deaths. And the fact that now, there's been several weeks actually in Montreal that we haven't had any deaths, despite the fact that we have hundreds of cases every day. well, approximately 150 cases per day. So clearly, our vulnerable populations are vaccinated at a very high rate, and they're probably a bit more careful with their social contacts, and we see that we can, in these age groups, that we can well control the negative impacts of the virus. 2 weeks ago, Dr. Kaliza said that we weren't going in the right direction. He called on young people to get vaccinated, but the whole of the population, to strictly apply the sanitary measures. Are you seeing that his call was heard according to the numbers? Well, we're progressing with vaccination, and with the 18 to 29-year-olds or the 18 to 39-year-olds, clearly, we reached a lot of people with their first dose. We're at a rate now of 83% of vaccination with one dose, which is still an indicator that they should go get their second dose shortly, and we're at around 68% of second doses. We still have some work to do, but overall, we're seeing that this age group and the strategies that we have put in place to reach them seem to be working. The 12 to 17-year-olds, we still have some efforts to make, and we've got some strategies that we'll present to you shortly, and they will be added to the visit of the schools.
Bonjour, Normand Grondin, Radio-Canada.
Question? You said earlier that we're going to have vaccination data by neighborhood probably next week, but do you know, I mean, it was worrisome last spring. Have we progressed substantially or not? Otherwise, what strategies do you have in mind? Because, well, vaccination per neighborhood, if it's not up to date on the website, it will be, because this is data that we follow, and all of the strategies from this summer were done. You know, we had some big strategies for the 18 to 34-year-olds and the 12 to 17-year-olds, but we also added some strategies to really improve the vaccination rate in certain neighborhoods. We had the pop-up clinics, you know, for the second dose, because if they didn't go for the first dose, they're not going to travel to get their second dose. We see a progression, but it's the same neighborhoods. There are some neighborhoods where, unfortunately, despite the efforts, we're seeing that their incidence rate is going to be greater. And some of these neighborhoods are neighborhoods where we've got a higher incidence, a rate of positivity that is higher right now. So we can clearly see that there was a relationship between vaccination and the places where there are outbreaks. So perhaps I can present the numbers in detail, but we've got neighborhoods. Well, we've progressed nicely. If I look at Parc Extension and all of that, we've had good success in some places, but there are some neighborhoods like Saint-Michel where it's more difficult to reach more people. Are there new strategies to try to reach these people? I would say that, well, there were some strategies with the religious communities, with the pharmacists, etc., in parks, events, and what we're concentrating on for the next 2 weeks is the visits in high schools with teams. We've also had a lot of strategies, for example, with businesses, the taxi companies, the high-risk companies that we've identified this summer, but we're going to get 50 or 60 or 100 vaccines, you know, per event, let's say. So it's a lot of efforts. It requires a lot of effort. But like I said, every vaccine is worth its weight in gold.
Bonjour, Madame Drouin.
Question? When you spoke about the importance of remembering not to hug and all of that, do we remember last year there were... Do you have the impression that we'll have to come back to a type of... Well, there was a threat of sanctions that was greater last year. Will we have to go back to that? Well, I hope that we won't need to use these measures once again. I think that now we're facing the fourth wave. The fourth wave, as I said, and we must be proud of the vaccine coverage that we've got when we compare ourselves to other countries in the world. We clearly, in Quebec and even in a big urban center like Montreal, because we know that it's more difficult to have high vaccine coverage in urban settings, I think that we've got something to be proud of. Unfortunately, it's not enough to be able to eliminate all of the restrictions. So we've got some work to do during the fourth wave, the vaccination of the 5 to 11-year-olds, and afterwards we'll see if we'll be able to go down in age groups. But with the people who will have had the illness, like I said, during the fourth wave, we'll probably that we'll be able to perhaps imagine afterwards that I hope that we'll be able to not have any coercive measures and to restrict people. This was never an approach that I like, especially for individuals. On vaccination, are we seeing the same? Do we still see these inequalities, economic inequalities or ethnic inequalities in the rate of vaccination that we saw at the beginning of the year? Yes. It's the same ones that we tried to mitigate through different strategies. And they worked in part. I think that we had a lot of collaboration from the communities, and we have some leaders who have helped us to demystify. And I think that there are some anti-vaxxers that we can't negotiate with, but in some communities, they're not really anti-vaxxers. It's just that we have to take the time to explain and to answer their questions, to get to the bottom of their fears, and that's why we've got our squads that went to old age homes. Well, now we've transformed it into a squad for people who go to these places to really, one by one, talk to the people and to demystify the misunderstandings. There, for example, there are young women who think that the vaccine will have an impact on fertility. So how do we demystify all of this? That's it for the questions in French. We'll go to the English questions.
Oui. On débute en anglais avec Andrew Brennan de CTV. Une question, une relance.
Salut, Dr. Drouin. I guess I wanted to start off with looking at workplaces. Quebec Public Health just put out a recommendation to delay the return to work, considering we also have going back to school. And the health minister saying yesterday this is something preoccupying. Do you think this is the right time for, I know the downtown core really would like to have more people back, but do you think this is the right time to have people coming back physically to work?
No, I do approve with the recommendation to delay the re-entry of the workers in the workplace. And to maintain remote working, knowing that and in a context like Montreal, where we have a collective transportation also that is quietly used for students that have re-entered university and cégep, I think we have to make sure that to see the impact of the reopening of schools. And I think it's just one measure that we're adding to make sure that we're not putting oil on the fire and trying to reduce the incidence of outbreaks in those settings.
I did have another question on oil on the fire, but I really want to talk about schools since we only have two. So with schools, first of all, with 52%, this is not at the level that we would like to be. How do we get more young people, despite all the efforts that we have done and are going to continue to do, how do we get these numbers higher? How do we convince the hesitancy or potentially the apathy amongst young people to be able to be vaccinated? And do we need to do more in schools right now beyond just masking?
But we will be in schools, in every high school, to make sure that we do promotion and we offer vaccination to the students and the professors. So we have, for the next 2 weeks, we will be in all schools. We're also preparing a campaign that we're going to launch next week, so I'm not going to give you the punch right now on this campaign to make sure that is really focused on the 12, 17 years old. And I think the vaccination pass that will be applied on restaurants, cinema, and activities in school, parascolar activity in school, will also be an incentive to get some youth vaccinated. So I think we'll see in the next week, in the next couple of weeks, if it works. We have already done some intervention in cégep We were expecting more people coming for vaccination. At the same time, we have higher rates of vaccination in Cégep and university, but we did not have that many people coming to get their doses. So we'll see if in high school it is better. Thank you.
Hi, Olivia O'Malley, Global News. I'm going to go back to the school with these vaccine percentages still pretty low. Will you be asking for any stricter measures than just masks in high schools and elementary schools?
At the time we're speaking with what was announced by the government, we're not adding measures for the reentry. As I was saying, we're working with schools. Some schools have decided to restrict the contacts between groups, and we're asking school to put some measures that were there at the last spring and that will facilitate us when we have cases to search the contacts and to reduce the number of contacts. Because if we open les cours d'école, schoolyards and people and youth play together, and it's open to everyone and there's no restraint, of course we will have more contacts, and when we have one case we won't isolate necessarily the class, but we will have many contacts in other class that we will need to isolate. It's the same thing for the time people are eating in the cafeteria. If we have different, and if every day it's different person, we will have to isolate many persons. So we're looking at some measures that are not equivalent to the balls, the bulk that we had last year, but that will certainly help us to manage when we have contact tracing that we have to do.
And you said that almost every day more than half the cases are associated with the Delta variant. And with this low vaccination number in schools, how concerned are you for the return back to school with the Delta variant?
We are concerned. At the same time, we know the strategies that have to be in place to control the outbreaks, to make sure that they're not so big. And we saw it in last spring when we have put in place the mask in high school in January and in primary school in March. We've seen that it was easier to manage, and the number of people implicated in outbreaks were lower. But at the same time, knowing that the Delta variant is it's really more contagious, we are expecting to have a larger number of cases. So we'll have to adjust ourselves, of course, in the next couple of weeks in the measures put in place. And it is not, if we have some neighborhoods or some schools where we see that we have too many outbreaks, maybe we'll have a more suppressive approach, or we'll add some measures because of the specific context. But in other schools where we do have schools who have more than 85% of vaccination, of course, maybe the measures won't be applied overall. Thank you.
On va passer, Dr. Drouin, au téléphone. Il y a deux journalistes qui sont là. Première journaliste à poser la question, Lauren McCallum de CBC. Une question et une relance. Et elle sera suivie de Chad Dunleavy de Gazette. Lauren McCallum, la parole est à vous.
Thank you. Hello, Dr. Drouin. You touched on it just before about you might have to adjust next week, is what you said, as the kids go back to school. What ways are you looking to adjust, and what kind of adjustments would those be?
But I think we do know the measures that could be in place because they were applied last year during school. So of course we could put in place, of course, les bulles class, or measures that would reduce the number of contacts children have. So it could be those kind of measures that could be in place, but I think we won't go further than what we've done last year, of course, and what we may do is that we may apply those measures not in all schools, but in some sectors or some schools where it is more difficult to manage outbreaks, or we see that even with all the efforts we've made, we do not have a vaccine coverage that is sufficient, and it is quite difficult to control the outbreaks.
Okay, and my other question is, I'm listening on the phone, so the quality isn't wonderful, but you said there have been outbreaks in the dance community. Can you just elaborate on that a little bit more about what you're talking about? And as we look at like public health saying we shouldn't be going back to work, can you talk about outbreaks at work and in the community besides right now?
The dance community, I said the dance community, but it's not one community. I said it's like we have 11 outbreaks in different gatherings, festival, schools of dance, activities in parks associated with dancing. So they're not linked together. But what we see is that those 11 outbreaks do concern people that do dance in those activities, but also spectators. So that's why and of course we do the contact tracing, but sometimes it's difficult to have the names of everyone that were in those events. Sometimes it is on Facebook of those events that we can spread the message to be more vigilant. And that's why we're asking people that do attend those types of events to be more vigilant, because the virus is circulating, and it is, we're asking people to wear masks or keep their distance, and of course if they have symptoms to get tested.
Thank you.
Thank you.
Chad Dunleavy, you can ask your questions.
Hello, it's Chad Dunleavy at the Montreal Gazette. My first question is, can you describe what the models are showing for how the fourth wave could affect Montreal?
The models that are developed, that are used at the provincial level, are developed by the NSPQ. I haven't seen the last version of the models. I think they're working on it with the data, because they're usually using hospitalization data, but with the small numbers they have to rethink their methodology. What we have in Montreal as models, we're seeing a rise of cases that is significant, and that is going to continue for the in the next couple of weeks. We only have a model on cases, not on hospitalization at the time we're speaking, but we have the INES that has published its model, and that do predicts a rise in hospitalization and intensive care unit admissions in the next couple of weeks. And it do concords with the rise of cases that we will see in the next weeks. So at the time today, yesterday we had more than 200 cases, but with the school reopening, we may have more the same level as we had in the second wave.
Okay. And are there any measures that Quebec is not doing right now, or that Montreal is not doing yet, that you would like to see imposed, or you feel that might need to be imposed if things get worse?
I think, as I was saying, of course, we will have to have a close look on the schools and the impact of the reopening of schools, and see if we have to add some new measures. I think at the time we're speaking, we're not talking, we're at the populational measures are more at the green level, the same as in the summer. Our indicators are rising. The situation, the decision is not to go back to the system of red or yellow or orange colors to have we encourage vaccination. Of course, we ask people to keep their distance, and we have the vaccination pass. But if we see that we cannot control the progression of the fourth wave, we'll see if we have to go back to populational measures, and we will do those recommendations.
Merci beaucoup. Thank you very much. C'est ce qui...
By populational measures, what do you mean?
Now, for example, the number of people that can attend an event or a restaurant or a show, we have measures, actually, current measures that are more at the green level. And with the vaccination pass, we want to maintain those measures so that those places can stay open even though we have a fourth wave. If we see we cannot control with those the outbreaks in those settings, will we have to close or to reduce the number of people that can attend worship places or cinema or restaurant, we'll see, but at the time we're speaking, we do not, it is not what we would like to do. We would like to use the vaccination pass, but maintain the same measures as we had during the summers.
Thank you for these details. Merci beaucoup tout le monde. C'est ce qui termine cette conférence de presse. Dr. Drouin, thank you very much.
Thank you.
Bye-bye.
Vous êtes le dernier participant à la...
Merci beaucoup tout le monde.